Great. Well, welcome everyone to our webinar today. Our topic for today is the Katie Beckett waiver program, instructional step-by-step guide. Hopefully make it a little bit easier to understand the process. So Dylan and I are grateful for your time today. I am Allison Wiest, and I am a trainer with Maine Parent Federation. I have been with the agency since 2017. Initially working as a family support navigator, supporting families. And that more recently, it's been, I lose track, but 4 years, I believe, working alongside Dylan to create and present trainings, doing a lot of outreach to agencies and schools and families and working with youth. I also am a parent. Everyone at the agency has that personal lived experience. So I have 2 children. My daughter is 28 years old. I still have a hard time saying that. And my son is 13. He has a autism and intellectual disability diagnosis. So I have that lived experience navigating the systems in our state. So that is me. And I'll turn it over to Dylan to introduce himself today.
Just reposting the link. But my name's Dylan Campbell. I'm a youth coordinator and parent trainer here at MPF. And like Allison had mentioned, really the past couple of years, we've been developing and sharing these trainings across the state with, professionals, educators, youth and young adults. So I wanted to welcome you all for being here today. I just reposted in the box a link to our website. At this link, you'll be able to download the slides for today, which were recently updated to address a couple of changes. And then there's also a parent-friendly booklet that you can download. But with that being said, I'm going to dive in. So we are not a legal service agency. So this information for you is just general information for you and your family. So as we kind of dive in, we'll first review some of the important terms, and then we'll discuss what is the Katie Beckett waiver and how does that compare to MaineCare. We'll talk about the application process, and then we'll answer some questions that you have at the end. And again, that will be off recording to maintain privacy for our families. So a couple of the important terms to keep in mind is the first one being DHHS. In Maine, that's our Department of Health and Human Services, and they really oversee a bunch of critical programs here in Maine. So many of those being the Office of Child and Family Services, the Office for Family Independence. And today we're going to focus, really on the Office of Family Independence and the Office of MaineCare Services. So when we're thinking about DHHS and the Office of Family Independence, this is the agency that determines whether somebody's eligible for MaineCare, including Katie Beckett. So then there's the Office of MaineCare Services. This is the DHHS agency that pays providers for the services that they provide. So they're really managing a lot of the financial, the connection between agencies and those fiscal services. So the Office of MaineCare Services facilitates the medical assessment process with Centra, which is a third-party agency, and collaborates with the Office of Family Independence to determine that medical eligibility. A couple of the other partners that we have within Katie Beckett is Centra. So previously, this was a program or a service called KeyPro. In the past couple of years, they've rebranded into Centra, but this is a third-party agency that has a contract with DHHS to complete those medical assessments and determine if that child meets the standards for the care. So Centra is contracting with our departments to provide those medical assessments. Additionally, we have our medical review team, and this is a collaboration between DHHS, our Department of Health and Human Services, and the University of Massachusetts. So this team is responsible for reviewing the individual's medical documents and determining whether or not they meet the Social Security Administration's disability standards. All of these partners are working together, and as we're going through the process, and we'll try to let you know who's facilitating your documents and who you can reach out and connect with. The big question is, what is Katie Beckett waiver? So when we think about Katie Beckett, The simplest way to put it is it's a way to access MaineCare for those folks who may not qualify through their financial means. So it's a way for children to access MaineCare benefits and qualify based on their disability or special health care needs. So when a young person accesses Katie Beckett, they're accessing all of the services that MaineCare provides, including the benefits of insurance coverage for doctor's visits, access to therapies such as physical therapy, occupational therapy, and speech, as well as the ability to access waiver programs such as Section 28 in rehabilitative community supports. So once a young person accesses Katie Beckett, they're accessing all of the services through MaineCare. So who is eligible to receive benefits through Katie Beckett? So this is going to be for individuals who are under the age of 19. And this young person must also have a physical or a mental disability that will last at least 12 months. And this is for a young person that cannot do what other children of a similar age can do. So within the Katie Beckett waiver program is that the child does need to meet that Social Security definition of disability, also using the young person's income qualifications. So this child does not have resources greater than 2,000 and has a monthly income less than 300% of the Social Security income. So using the young person's income, they must not have greater than $2,000 of assets. And for many young people, they might not have their own income. Is also for young people that may not qualify for MaineCare under any other category. It's also for a young person who requires, again, that level of care. That, to put it in simplest means, Katie Beckett is a way to access MaineCare for those individuals who may not qualify through the income means, but have shown and proved a need through the medical but have disability needs.
Sure. Thanks, Dylan. And again, I'll just sort of reiterate what Dylan was saying. Again, MaineCare being, we're looking at income. It's an income related, program that's offered for families who have limited resources and income. Whereas Katie Beckett, they're looking at not only the income and the assets of the child, but they're also looking at the medical diagnoses. So we're looking at two things with Katie Beckett, financial and medical, that medical need, versus with MaineCare, it's just looking at the financial aspects of the situation. So step one is filling out that MaineCare application. So it always starts with the MaineCare application. Families, would first apply through that income related eligibility criteria to see if that family qualifies. Again, looking at that modified adjusted gross income, what does the family have for assets and financial means? So again, the application starts with applying for income related MaineCare. This is a snapshot. The application is online. There's a link included in these slides to start the process of the application for MaineCare. There's also an online portal for MaineCare. It's called My Maine Connection. And that's where families can see where their application is, related documents, messages from the office, and things like that. So this is how the process would start. So in filling out the MaineCare application, there's a lot of documentation that's required. And some of the things that they might need to determine eligibility obviously would be income. So pay stubs from an employer, bank statements, if families have retirement accounts, loans, driver's license. If there's unearned income, that's another important one too. So if there's a family situation where the family, is divorced and there's child support that is coming into the home, they'll want to see, statements about that, official documents about that. So again, anything related to finances and assets, they will need to determine eligibility under the income related MaineCare. So one of the other things that's, again, because it's income related, the application is also used for other programs as well, benefits, public benefits. So state supplement, prescription help, family planning services, Medicare savings programs. So again, programs like SNAP and TANF, those are other public related programs, supports for families. So this application is also used for that. Again, just really important to pay attention when you're filling out the application to ensure that all the information is accurate, so that it's processed correctly. We do have, and I mentioned that initially when I started with Maine Parent Federation, I was a family support navigator. We do have family support navigators that are our support person to families. Our service is free for families, and they can really help families go through the process if it's, again, it can be confusing and there's a lot of documentation that's required. So they can help families through that process as well. One of the things that we mentioned to families is that when they're filling out the MaineCare application, that and I don't know, I've heard more recently that it is a more streamlined process, but on the MaineCare application, making a note on there that that this is a child that has a medical need or a disability, so that again, we're the eligibility person that's looking at this can catch like, oh, okay, like maybe this family doesn't meet the financial means, but there is a medical diagnosis or disability involved, and that might help streamline the process through the steps. So filling out the MaineCare application, if a family doesn't qualify for income-related MaineCare, then they'll receive a denial letter. But it's important to know, and that's why, again, I sort of mentioned making a note on the application about the disability or the medical diagnosis. It doesn't mean that they automatically are not eligible for Katie Beckett. And I think that sometimes for families that they get the denial letter and they think that's the end of the road, and it's not. It's just part of the process. So in order to be found eligible for benefits, the Office of Family Independence will determine whether the child meets the financial rule as well as the medical rules. So that's kind of what I was talking about with MaineCare. It's financial. With Katie Beckett, it's financial and medical. The financial rule for Katie Beckett, again, Dylan mentioned this, but the child does not have resources greater than $2,000, and that they don't have a monthly income, that their monthly income is less than that 300% of the supplemental security income. And again, for a lot of kids, especially younger, they're not going to have any income, and the likelihood of the income being more than that 300% of SSI is a lot of times unlikely. And then the medical rules as well, that they're meeting that criteria and considered disabled under the Social Security Administration. So every year a financial review is done. This again to determine whether some families might not be eligible for MaineCare in one particular year when they initially apply, and then the next year when an annual review is done, maybe something has changed in the home. Things are always changing, right? People moving jobs or losing jobs, or a lot of things can happen. And so it's important to have a financial review every year to determine, again, maybe a family might move from Katie Beckett to a MaineCare, or from MaineCare to a Katie Beckett related coverage. So it's just really important to know that the annual review is coming. If you have, if you can start pulling together the information and having that readily available, that's always helpful as you're going into the annual review process. You will receive documentation from somebody that the annual review is coming, and so that will signal you to start pulling that information together.
Step 2 can really happen simultaneously with step 1 as well. So if families know that they might be trying to apply for Katie Beckett. They might want to start this part at the same time as as a best practice, submit it at the same time. So that can really streamline the whole process here. Do not wait to receive a determination about eligibility based on income before completing this disability determination packet. So oftentimes, families may not be aware of this step as well. Again, you're going to need to gather some information as well for this. That can look a lot like information about the nature of the disability. Might look like gathering extensive health history, any education or potential work history that the young person might have. And it might be beneficial to include any evaluation of activities of daily living. Again, some other best practices with this is to attach a letter or a note. Again, I think this is what Allison was mentioning earlier, where I think recently they have added in some options on the form to indicate you are applying for Katie Beckett. But again, if possible, you could attach a statement to the document, to staple it right to the back. The goal here is that we're trying to flag our application during the process, so that the people reviewing it know that we're trying to apply for Katie Beckett. So again, if a family did not qualify for MaineCare under those financial qualifications, they should automatically screen your application for Katie Beckett. Again, it's just nice to have those additional measures to make sure that through this automated process, it can get flagged by a human review person. This disability determination packet that we're filling out that has the information about your young person's nature and education and work history, this will be then reviewed by that third-party medical review team. And again, that's the collaboration that we have between DHHS and the University of Massachusetts. This is if you folks can see that, because I'm actually having a hard time seeing that. This is just an example of a release. So these releases are important for families to have signed and documented, because it'll allow the communication between any of the providers providing information to the Office of Family Independence when they're reaching out. So again, just as another best practice, just making sure that any releases that may need to be signed are signed and properly filed, as this can again really streamline that process for families. We do have a link here where you can access that disability determination packet. And again, if you're going to be applying for Katie Beckett, trying to fill out both that MaineCare application and this disability determination packet at the same time. And so at this point, if you have any questions or you would like an update on the status of the medical review after it's been submitted, the person of contact would be, or the agency of contact would be, the Office of Family Independence. So after both the MaineCare application and the disability determination packet have been received, that medical review team will assess any information. So at this point, if they would like additional information, they might contact any medical providers. They might reach out to you as a parent to provide more information. But again, I think the key for this entire process is anticipating that they're going to be asking for all this information and gathering it ahead of time. So another best practice that we have here as well down at the bottom is, if you are anticipating any information needed from medical providers, it's important to let them know well in advance, as Katie Beckett will only have 30 days to submit documents during those medical review. So making sure that we've had some of the communication beforehand, we get our releases signed so that information can be shared, and then giving your medical providers enough time to be able to put together that information that the team might need.
So the next step in the process is a Centra Health assessment. So what's going to happen is, you can switch the slide, Dylan. The eligibility person specialist at OFI, the Office of Family Independence, will make a referral to Centra, who used to again be KeyPro. Again, they're going to be determined whether they qualify for Katie Beckett. A registered nurse who works for Centra Health will perform either an in-person or virtual. We do so much virtually now, to assess the child's level of medical care. I think for some families, we hear that, they're nervous because their child is being evaluated. It's nothing to be concerned about, but they do have to, see the child and evaluate whether the child is in need of this level of medical care. And again, the assessment is usually done within the office, and the child must be there. But I do know that these evaluations also have been done in a virtual type of arrangement as well. So the medical review team will share the medical information that they've already collected from the family, as well as, the medical team, doctors and other people that work with the child. They're going to share that information with Essentra. Essentra at this point so again, sort of a shifting, Dylan was talking about the different agencies within this process. So now the sort of responsibility or the oversight is going to be with Essentra. So they may still contact a family or the providers because they want additional information as well to complete their part of the assessment. So again, at this point in time, if you have questions about where the application is in the process, now the communication is going to be directly with Essentra, and that is their phone number at the bottom. So their assessment, again, nothing to be concerned about, but it is a pretty comprehensive, assessment, and a lot of documentation is required. So medications, diagnoses, again, any sort of evaluation, appointments with physicians, if a child receives specialized services through an IEP, a treatment plan, an IFSP, family service plan, any of those types of things, they'll want all of that documentation, progress notes, reviews, and all of that. So again, it's pretty comprehensive. I'm making sure that that families, have all this information and gather all of this information. I think, there's nothing more frustrating than, not having the information and trying to scramble to get the information. And again, we're trying to show that this child needs this level of medical care. So really important just to have all the documentation to show the need. In addition to clinical documentation, they might also want some other information like psychiatric or psychological evaluations, social evaluations. If a child receives, speech, OT, or PT, any sort of evaluations or progress reports on that. And then if a child receives nursing services, they will want the nursing plan as well.
Once we've submitted the MaineCare application, the disability determination packet, the medical review team has taken a look at it, and then Essentra has done their assessment. We'll then have a notice of decision. Many parts of the system are automated, so if you ever believe that your notice of decision was made in error, it is important to be able to, again, gather the material to justify it and then reach out to appeal that decision. So once all the reviews are completed, the Office of Family Independence will then make a decision stating whether or not MaineCare has been granted via Katie Beckett. If MaineCare coverage is approved, you will receive additional mailings with information about premium cards, about premiums, as well as an official MaineCare identification card. However, if the young person has been denied coverage, and like I mentioned before, if you believe it was made in error, you may contact the Office of Family Independence to appeal this decision. Within that letter, that denial letter, it will state reasons for why your child has been denied coverage. So again, gather information and contact the Office of Family Independence to appeal that decision if you believe it was made in error. If MaineCare coverage was granted through Katie Beckett, you may also receive additional information about premiums. And again, these premiums will look different for each individual. But premiums begin at the onset of coverage and can be organized into 3 monthly blocks. You can pay monthly or 3 months at a time, much similar to other health insurance plans. But however, these premiums are determined based on the family's income and size. It's much like private health insurance. It's important to pay premiums on time. There is a note here where if you pay monthly, payments are due on the first of the month, whereas if you're paying quarterly within 3 months worth, those are due by the 15th of that third month. And again, it's important to make sure that those are paid on time, as like within other health insurance plans, there may be a lapse in coverage.
I think the other thing too that I would just mention is that it's really important to make sure that the Office of Family Independence and the Office of MaineCare Services have your updated family information, whether that's your mailing address, your phone number, your email, all of that, that you're staying up to date with all of that, because again, that's how things fall through the cracks, or if they're trying to get a hold of you, or you need to pay a premium, like all of those things. So making sure that they have your updated, things change in our lives, people move and change emails and all of that. So just important to make sure that your information stays up to date with these agencies. So step 6 is the annual review. So there are up to 3 parts of the annual review every year. As I mentioned, there's a financial review that's required to make certain that the child or the family does not qualify for MaineCare or Magi income related coverage. And again, monthly premiums can change depending on whether you know, the family qualifies for Katie Beckett and the income has changed, or if they qualify for MaineCare, they may not have any premiums. So important to just have all of that information and know that there will be a financial annual review each year. Step 2, again, or another piece of the annual review is Essentra will perform their level of care assessment again and require recent documentation. Like again, they've already received a lot of information, past documents about the child, but they'll want recent updated information and documentation from medical providers or people that are working with the child. And then the medical review team will also is required every few years. Again, the frequency of that changes. It's on an individual basis and dependent on the child's diagnosis, but they will do a medical review periodically as well. The review for Essentra is consistent with the initial assessments for the Katie Beckett. So it's again the same documentation that we talked about earlier, and they must be updated yearly. Essentra will mail a notice with a list of the required documents to the family about 2 months in advance of the annual review coming. So again, just really important to have all of your updated information and start gathering all of that together. Contact your medical providers well in advance, because again, we know that sometimes it takes a little while to get that documentation or even to hear from a medical provider sometimes. So just being on top of it and knowing it's coming is really important. Essentra will also call 1 month before the reassessment is due to schedule that parent interview. Every 3rd year, the interview must be done in person. Otherwise, it's done over the phone. Again, as I mentioned, sometimes it's done virtually like this. And then when the assessment occurs in person, the child is required to be there. If it's over the phone, then it can just be the parent or guardian that's participating in the review with Essentra.
So this is a quick snapshot. Again, step 1 and 2, they can be submitted simultaneously, but that's the MaineCare application that you're filling out and submitting to the Office of Family Independence. We also have our MaineCare Disability Determination Packet. The Office of Family Independence will make a referral to Essentra, which is that third-party agency. They'll make their review, and then the Office of Family Independence will let you know whether or not MaineCare coverage is being provided or denied. If it's being denied, again, you can file an appeal, but if it's being provided, keeping in mind that your monthly premiums will be due. That can change each year depending on if your finances changes as a family. Annual reviews are held to redetermine financial eligibility each year. So again, keeping in mind that you'll want to gather any updates or changes that occur throughout the year. I'll give a quick synopsis and then I'll hand it over to you, Allison, if you want to explain more about it. But our family support navigators are, one-on-one support. We have a couple navigators here today in our chat box, but they are a way that, we can connect families with other families that have had real experiences navigating these different systems of care. And Allison, if you wanted to explain more, I'll hand it over.
Sure. We actually have some family support navigators in the room with us today, so grateful to have you here. Our family support navigator program is a program that has been around for a really long time and probably our most utilized program. It is parents that have been navigated the different systems of care. They have lived experience. We have a training program that they complete, and then they are available to support families one-on-one and help them with a lot of different things. It can be just a matter of gathering paperwork or sitting next to them when they're making a phone call to find out about a MaineCare application, or it can be going to an IEP meeting, helping them prepare for meetings or appointments. And so there's a lot of different things that they can do. And again, they are a valuable resource to families and can help them through this process as well. We typically try to match navigators when a family contacts us. Whatever the need is, we try to match the navigator, based upon the need, somebody that has the experience. Sometimes within the area, especially if it's some type of support that a family needs in person, or again, it depends on the situation, but it's a valuable resource to families, and it's no cost. So again, a nice helping hand as you're going through this process.
And as always, feel free to stay connected with us. We're on most of the social media platforms, so Facebook, Instagram, X, YouTube.